Over the course of the last century, our planet has become warmer, but in particular over the last 50 years. It is now recognized that human activities are largely responsible for this warming. In particular, the burning of fossil fuels has released huge quantities of carbon dioxide and other greenhouse gases, which trap additional heat in the lower atmosphere. The impact of this is being seen worldwide as glaciers melt, sea levels rise, and there are more desert areas. The African continent is particularly exposed and vulnerable to the negative effects of global warming. Therefore, the African Union and the European Union have started to work together in the three key research areas affected by climate change: water, agriculture, and health. The result of this decision was a call for project proposals, the FP7 Africa Call, out of which several collaborative research projects were funded to help people coping with climate change.
About 3/4 of the people are infected with malaria because of this land is in between the two rivers. And around here there's also another lake which is coming up. So it seems the breeding places is very close. So that's why mosquito is there are very many mosquitoes which is actually affecting people. That's why they are mostly infected with the malaria.
The leading medical journal The Lancet, together with University College London, described climate change as the biggest global health threat of the 21st century. Nowhere is the situation more acute than in Africa. With just 12.3% of the world's population, but 25% of the global disease burden, it is vital that Africa and the international community address this issue.
Africa is very vulnerable to climate change. The reason is because Africa invests in climate-related investments or activities. Africa invests in the use of water directly for agriculture. They are rain-fed. Most of the agriculture in Africa is rain-fed directly. So when rain fails, the agriculture fails. Africa depends on hydro power electricity to a large extent. So when there's no rain, you have no hydropower. Africa depends directly on rain to supply water to the dams for the supply in towns and to communities. So when rain fails, the communities, the municipals are in trouble. So Africa is very vulnerable.
The EU has a long history of research collaborations in Africa and is currently funding two projects, Healthy Futures and QWeCI, through its 7th Framework Programme, to look at the issue of climate change and health.
It is recognized by the scientific community that climate change will exacerbate existing risks to health. And so the populations that are now facing severe climate-related diseases will be the ones most severely impacted also in the future. And in that regard, Africa is amongst the most vulnerable regions in the world. In addition to that, they're lacking an appropriate adaptive capacity to cope with those important climate-related diseases. The two main projects, QWeCI and Healthy Futures, they are focused on the impact of climate change on vector-borne diseases, on major vector-borne diseases that are present in Africa. The two projects are complementary. The project QWeCI is more focused on the western part of Africa, whereas Healthy Futures on the eastern part. And they are both looking at major vector-borne diseases that are currently present in different African regions, such as malaria, Rift Valley fever, schistosomiasis, and a series of tick-borne diseases. They have common objectives, and mainly they are trying to improve the knowledge we have on how environmental factors, but also socioeconomic factors are impacting on the distribution of the vectors that are carrying the diseases. And related to this, based on an improved knowledge, they're developing decision support tools that eventually should enable local players such as health and veterinary services and also policymakers to better predict disease outbreaks, and based on that to improve their adaptive capacity to cope with these very important climate-related diseases.
The three infections we're studying within Healthy Futures are malaria, Rift Valley fever and schistosomiasis. Malaria, of course, is a very well-known public health problem. It affects hundreds of millions of people across the tropics and subtropics, with many hundreds of thousands of deaths annually. It's transmitted by mosquitoes. Mosquitoes are, of course, very susceptible to temperature changes, so we're interested in how climate change in particular will affect the life cycle of mosquitoes and the malaria parasite itself. Schistosomiasis is a worm infection that lives in the blood. It affects between 200 and 400 million people, again living in tropical and subtropical areas. It can live for several years and it creates disease. It's less fatal than malaria, but it can exist for a long time and affects people their entire lives. Rift Valley fever is a virus. It's an epidemic virus that tends to occur only once every maybe 10 years when there's extreme weather events. Again, it's transmitted by mosquitoes. It affects mainly animals, but can also affect humans. So within Healthy Futures, we're working collaboratively with a range of partners within East Africa. We work with the Ministry of Health in Uganda. We also work with the Ministry of Health in Rwanda. And we're involved in training exercises, particularly for Rift Valley fever and schistosomiasis. We're training PhD students. We're working with ILRI, which is the International Livestock Research Institute in Kenya. And we have a number of PhD students who are part of the Healthy Futures training program. So we're bringing together collaborators from different backgrounds, from government, from meteorological institutes, from academic institutes and research institutes in both Europe and Africa to work together. Society is complex, and many of the problems that we face as a society are also complex and cannot be solved by one person working alone. We have to collaborate in order to really understand how these issues affect us and how we can then intervene with the right kind of solutions. We need to bring actors together from different areas, from the public and the private sector, but also from civic society, academic researchers. All types of basic and applied researchers need to work together to come to a more holistic and complete understanding of the issue before you can really tackle it properly.
I work with Rift Valley fever, which is a mosquito-borne infection of cattle and people. It's one of the diseases which is climate-driven because it's influenced by the population of vectors and the distribution of hosts. I see attempts by the local people to contain the disease by doing land use changes, which actually exacerbate the appearance of the disease. For example, because these dry lands are becoming less productive, so we see more of irrigation being done, sort of like to improve productivity. But in a sense, those interventions are also they tend to increase the risk of these emerging infectious diseases, specifically Rift Valley fever, because of the water, the appearance of vectors. The first step is to work with them to understand the risk of exposure, to understand what are those practices which make them to be more exposed to the disease, so that we can do behavior change interventions. So that would be one way of working with the local people to develop their own interventions on the ground. The other thing will be working with decision makers to improve their policies for the disease. So, for example, developing decision support tools which will help them manage the disease better.
Some 10 years ago, people were healthy and we were eating animals product without any problem. But now it seems the animals are sick, people are sick, everybody is sick. Sick with this issue with malaria. Almost every week we have about 15 children missing school per week, 15 to even 20 because of malaria.
The impact of global warming on temperatures is that disease patterns are changing. For example, malaria kills around 660,000 people a year worldwide. It is expected this may rise as malaria begins to spread into new areas. QWeCI is a research project working in West Africa and Southern Africa, which measures the effect of climate change on health in Africa.
We're looking at seasonal timescale forecasts for rainfall and temperature, and using that information to predict the risk of a range of diseases. We're working on both malaria and Rift Valley fever, which are diseases which are carried by mosquitoes. So how many months of the year does it rain? And if the temperatures are viable for both the growth of the insect, let's say a mosquito, and also the growth of the infectious agent, particularly when it's developing inside the mosquito. Having local partners is essential for working in Africa. We're working with both African scientists, who are very much the same as me, they're working on scientific problems, and we're also working with a range of stakeholders, including National Malaria Programme and the National Livestock Programme in Senegal. The African scientists are using our models to work with their decision support partners in the Ministries of Health and the Ministries of Livestock. And this is really, the project really is a two-way exchange. Information comes from Africa, information goes from Europe to Africa. And without the partners in Africa, we would not have such detailed information. The work is important because we leave a legacy behind in Africa through the training of a whole generation of research scientists in the institutions where we work. We've also brought together European researchers in ways that perhaps had not occurred in the past, and we actually are almost on the edge of being an operational early warning system for malaria. QWeCI and Healthy Futures projects would not have happened if it was not for the funding of the European Commission, and all the partners in both the projects are very grateful for the funding that has been provided.
Malaria affected these people in so many ways. One of them is lost work days. For example, these people in Marigat, and especially around this, the catchment area of this hospital, many of them do farming, and we use irrigation water for farming. So if somebody is affected by malaria, for sure they do not go to the workplace. So in that sense, it has affected people in that they cannot produce. They cannot produce their food, they cannot tend to their farms, they cannot tend to their cattle because some of the communities are pastoralists. So in that sense, it has affected them. And again, that means in the long run, it also affects their economy. And again, the impact of that is probably poverty, increased poverty levels.
So, is enough being done on a global scale to mitigate the effects of climate change on people's health in Africa, Europe, and elsewhere? And what other research is needed looking forward? One development, which will undoubtedly drive progress, is Horizon 2020, the biggest EU research and innovation program ever, with nearly 80 billion euros of funding available over 7 years up until 2020.
There's a lot more we could do with the ideas that we've generated within Horizon 2020 for new research project purposes. An obvious idea would be to look at more infectious diseases. We only had the scope within Healthy Futures to look at Rift Valley fever, schistosomiasis and malaria. But people living in the tropics and the subtropics are affected by a great range of different infectious diseases, including other worms, bacteria, viruses and protozoans. There's scope for incorporating some of the methods that we've developed in Healthy Futures to cover these other diseases.
Climate change is a significant threat to public health on the African continent. The World Health Organization estimates that the global cost of climate change to public health will be between $2 to $4 billion per year by 2030. The collaboration between researchers from the African Union and the European Union is starting to bring about positive changes to Africa's future. This can only continue if there is sufficient funding.
Reputations and